start by asking you all, have you ever written a note to yourself and then lost it? That's a couple hands. Do you struggle with remembering people's names? Have you forgotten to bring something with you when you flush the house? All right. Okay, you're in good company, I see. And if you say yes to one or all three of those, congratulations, you passed the test. I know that you are not aliens, and I know that you are not robots. I'm so grateful to be in your company. So yes, everyone struggles from memory loss from time to time. It's extremely common to misplace objects, forget people's names, forget what you wanted to do when you walk into a room. And occasional forgetfulness, it's just a part of life. And unfortunately, it gets worse as we get older. And as you can see from this graph, it actually starts to get worse starting right around age 20, which is right there. Yeah, and then it just keeps declining from there. So we've been experiencing it for a while then. But it's not all bad. There are some areas that do get better with age. And that's in regard to learning new words, new knowledge, world knowledge, information that does increase over time. But we are not super good at holding on to the things that we want to hold on to. Now, if memory declines naturally with age, how do we know what's normal memory loss and what's abnormal memory loss, like what would be associated with Alzheimer's disease or dementia? And really, it's the degree of memory change. So, for example, somebody who has normal age-related memory change, they might forget conversations or events that happened several months ago. But somebody with Alzheimer's disease would forget that information really rapidly within a few minutes, within a day or two. And in regard to name finding problems or word finding problems, that's one of the most common things that I hear about in clinic. One of the biggest concerns. And while that can be an early sign of Alzheimer's disease, it again is more severe than forgetting names of acquaintances or people that you see sometimes, or coworkers, if individuals who have more pathological types of memory loss. It would be forgetting people that you know fairly well, and it's not coming to that you very quickly. But regardless of whether your memory is normal for your age or abnormal for your age, there are memory support strategies that can help you. And so I'm going to be going over a lot of those today. But before we do any of that, we're going to start off with a little test. You're at a university. Did you think you're going to get away with not taking a test? Absolutely not. Okay, but what's really important about this test is it is not graded, okay? And this is just a benchmark for yourself. Keep in mind that you are not in an ideal testing environment, okay? And really, all I want to know is, is it supported by any of the strategies that we learned today? Okay, so let's do our pretest. So I'm going to say a list of words, and I just want you to try to remember as many as you can, okay? Do not write them down. Do not write them down. I just want to see what you can do without anything, okay? All right, so here's the list. Dog, stapler, horse, couch, paper, bird, cabinet, pen, bed. All right. Okay. How'd you guys do? How are you feeling? Okay. All right, I'm going to give you one more opportunity because I'm kind, okay? You get one more chance to learn these words. Ready? Dog. Stapler. Horse. Couch. Paper. Bird. Cabinet. Pen. Bed. All right. Now, write down what you remember. And as you're writing these down and trying to think of the words that you remember, I want to know if your strategy changed from the first time that I read the list to the second time, or did it stay the same? Same? Okay. All right. And what kind of strategies did you all use?
Okay, call the animals. I said the words in my head.
Okay.
First one I would say.
Okay. Grouping, kind of rehearsing. Okay. Made a story up. Great. All right. You guys are already listing off some of the things that we're going to be talking about today. So that's fantastic. I'm happy to hear that. Okay. All right. That's it for that test. Just hold on to that information. I'm going to talk to you about compensatory strategies. And it's another term for memory support strategy. And it's any alternative tool or action that can help you complete an activity. And all individuals, regardless of age or cognitive ability, and I put an asterisk by that, to an extent, I will say to an extent, can benefit from compensatory strategies. That said, strategy use does become more valuable as a person has memory difficulties. So they benefit from it more. And as a task becomes more difficult, if you put more strategies in place, when something gets more difficult, it becomes easier. And there are 3 different types of strategies that I'm going to be talking about today. The first is an internal type of strategy. So anything that you do in your own mind that helps you remember information. So the type of strategies that you just had to engage in to try to remember that list, because I didn't let you write anything down or put anything in your phone. That would be an external type of strategy. The last strategy type that we'll talk about today is task modification. So one of the strategies that I heard is repetition, rehearsing the information. This is a really common thing that we learn how to do when we're pretty young. And it's effective. And we know it's effective because research that prevents the use of rehearsal as a strategy has shown that memory recall declines. That makes a lot of sense. But here's a pro tip that if you want to remember information using this method is to try to space out the recall period and fill in the information that you didn't recall automatically so that you have a more complete picture, and then space it out a little bit longer and then a little bit longer to really help facilitate that learning and retention process. Another type of strategy is self-talk. And this can be done either by talking out loud or an internal type monologue. So, for example, with that list of words, you might say, okay, so first there was a dog, and then there was a stapler, and I remember that bed was last. Kind of make it so it sounds like you. And it sounds like your thought process makes it easier to remember later on. And you might ask yourself a question like, what was that word at the end? And that can be an automatic cue to help you pull out that information. Or I remember that there was animals. What animals were there? Helps you pull that information out when you give yourself a little bit of a hint. And this also really assists with planning. So saying something to yourself like, I need to do this before I do this, and then I can do this, helps you organize your thoughts around whatever you're planning. Now, one strategy that I heard from you was chunking, and this is an excellent strategy. This provides structure to what you're trying to remember and allows you to divide up the information that you're learning. So if you can remember the general category or the general topic, It's a lot easier to remember the things that fall underneath it. So instead of having to memorize 9 things, really you're memorizing 3 broad topics, and your brain really likes cues. It does really well with cues. If you give your brain kind of a general idea of what you want to remember, it starts to pull it up easier and faster, gets you access to that information. And we do this naturally. We did this when we had to memorize phone numbers. We don't anymore for the most part, but we did do that, right? We divided it up into chunks. And here's that list of words. I promised I would show it to you again. Here's that list. And you can see that I put them into different categories. So we have an animal category, dog, horse, bird. We had an office supplies category. I made this when I was in my office, as you can see. And then we have like a furniture category. It becomes easier when you put it into these chunks. Another type of strategy is called visualization. And with visualization, you can use either real or mind's eye imagined images. And use of imagination, you use imagination and you visualize the information that you want to remember. And there's actually really good evidence for this strategy too, as being quite effective. And research has shown that memory is improved when people create visual images. So let's take our list again and think about how we could visualize it. I heard somebody earlier say that they made a story. Really similar, right? You're kind of adding that context. So the more context that we can surround around this information that's kind of random, the more beneficial it is. And your brain, it's made to remember visual information. That's really what it's wired to do. It's made to remember our most important moments in history. And if you think back over the course of your life and the things that you remember the most, do they have an image associated with them? Yeah, like big birthdays, graduations, weddings. They all have that kind of image, that feeling that comes along with them. So for this list of words, I will also say that your mind likes things that are kind of silly, okay? So the more that you can make it interesting to your brain, the easier it's going to remember it. Okay, so how I make this silly, I can't just remember a dog. Like I could, think of my dog and that might help a little bit, but I don't have a bird. I can't just think of any bird. That's not really going to help me. I need to make it really attention grabbing. What is my brain really going to remember? And I also want to use some other strategies too. Combining strategies is going to be more beneficial to your brain as well. So when I was designing this, I was like, okay, what's going to grab my attention? I'm going to try and chunk all the animals together. And how am I going to do that? Well, I'll just pretend that a bird is riding on the back of a dog like a horse. That's silly. That's ridiculous. But I'm going to remember that probably a lot better than I'm going to remember a bird and an image of a horse and an image of a dog. But there's more words here. So then I create a story and I think, okay, now the bird's going to fly off and it's going to go staple a piece of paper that's written with pen on it. And then the bird's going to fly back to its cabinet to go take a nap. So I got to really kind of string that along to make it useful. And although this is very silly, as my 2-year-old child would say, very silly, I'm going to remember it. And I have remembered it since I created it. All right. And some other ways that you can kind of do this, you have two objects that really don't go together at all, a key and a tree. That doesn't go together really in my mind. So sometimes you have to integrate it in a unique way. So you could think of like a tree that's made of leaves that are all keys, or a key has to be used to open the tree. And for example, a tulip you could try to remember a tulip as a pretty flower that smells good, that's pleasing, or you could break it down and think of it in the word tulips. So really getting creative to help your brain remember this information. We all memorize things a little bit differently. All right, moving on to a different type of strategy is mental retracing. I'm sure we've all had to experience if we've lost keys or our phone or whatever in our house. And it's this attempt to relive or re-experience a past event. I put this after the visualization because it's really helpful if you don't just think in terms of what I did in a linear fashion when I got home. It's more important to really think about it and move through your house, or actually really physically move through your house. And what did you do? And make it really engaging to yourself. And also ask yourself questions. All right. Now let's talk about remembering names. That's an incredibly common memory problem. There's a lot of different strategies here that I'm going to go over. But in general, you want to try to link the name with something. So link the name with an interesting fact about the person, or try to associate their name with another word, or try and think of a unique physical feature about them and try to link their name to that unique physical feature. I'll go over a strategy on how to do that in a moment. Or you can combine these with other techniques like visualization. And again, more strategies that you use, the higher likelihood you have of remembering it later on when you need that information. All right, so here we have Ivan Gray. Pretty straightforward name, not too long. And first thing that I want to try to do when I see somebody like Ivan Gray is to think of, without knowing him, I just know his name, are there any physical characteristics about this person that I can try to link with his name? And again, these are always going to be a reach. They're always going to be silly. But a feature that he has is the glasses that he has. So you might think, Ivan Gray glasses. That might work. That's not terrible. But what if he's not wearing his glasses? That's not going to help you very much next time you see him. So maybe focus on his hair. I eventually will have gray hair. That might work a little bit, but what if he shaves his head or something? And then what do you have? Well, maybe I could think of a gray van doing donuts on their shirt. I don't know. There's a lot of different things that you can do. Here's some other strategies for remembering new names. Make sure that you repeat the name when you're introduced to the person, during the conversation, and when you say goodbye. Trying to say their name, using that repetition, that rehearsal method is going to be beneficial. Associate that person with another person with that same name or similar name. And if you know the person well, your brain just needs a little hint. It needs a little cue sometimes. And so doing an alphabet search can actually be helpful. So just going through the alphabet, saying A, B, C, D, your brain sometimes will give you a little bit of a hint or a little tingle when it's like, oh, it started with a D. And then you can kind of go through and think a little bit more linearly. You can also remember an interesting fact that's associated with that person. Again, if you give yourself a little bit of a cue, a little bit of a hint, thinking about where's the last time you saw that person, what other friends do you have in common, that can also be helpful for you. This is my favorite strategy. Just ask them. And use humor and just know that they probably also forgot your name, or they're using a strategy to remember your name. And also remind yourself and maybe even educate them that it's really normal to forget people's names. our brains are not very good at remembering that kind of information. Okay, couple more strategies here. The next one is called mindful memory, and it's using all possible senses to try and remember information. And this is really going to be important on the encoding part as well. So thinking about what does or would, whatever you're trying to remember, smell like, taste like, look like, sound like, feel like. The more information that you're giving your brain, the higher likelihood that you're going to be able to get that information out. And I think this might be one of the last strategies that I'll go over for the internal category, and it's memory palace. Have any of you heard of memory palace before? This is one of my favorite strategies. It's just so interesting. And it's also referred to as the method of loci, journey method. And it's a technique that uses visualization to help with encoding information. And there's 3 major steps. The first step is to imagine a physical space that you are very familiar with. So like your home, your childhood home, your place of work, whatever is like really well known to you. You know all the rooms in that space and you can walk through it in your mind without any problem. That's step 1. Step 2 is to take that list of items that you want to remember and place them physically in your mind in the different locations in the house that you have specified. And again, the more outlandish, the more physical, the more interesting you can make those memories of the items in your home, the more likely you're going to, the easier it's going to be to pull that back out. And then the third step is the recall step. And this is where you walk through that space again in the same order that you put the information in. So you go back in the same way. You don't skip around. You don't jump from one room to another room. You walk back through the house and you pick up all of the information that you put down. So here's an example. So here's a pick your house. You define where you want to place the items. You have your list of things that you want to remember, and then you go place those in those areas that you defined. And I was introduced to this strategy for this book called Moonwalking with Einstein. It's a bit dated now, but it's a really interesting read. And what's remarkable about this book is the author, he's a New York Times writer, journalist, and he was tasked to report on the memory championships, the national or international memory championships. And he was tasked to go talk to the person who won that year. And so he said, oh, how did you remember to, learn all of those things in that last championship game? And he said, the best way for me to tell you is to actually teach you. And so he taught the author all of these memory strategies, the primary one being the method of loci or the memory palace. And the very next year, the author won the championship by using this strategy. It is that effective, but it is time consuming. All right, so let's walk through a couple of items from our list. Okay, so our first item was dog. Now, like I said, you can have a dog running across your deck here. That's probably not going to be that interesting. So instead, you might think of your dog invited some neighbors over and they're out having drinks. Might remember that a little bit better. The next item is a stapler. And you could think of the stapler sitting out on the carpet, and that would be perfectly fine. Or you could think of it actually stapling the carpet down. That's going to be more interesting. The next item is horse. And I thought I could have any horse, or I could have Gumby. Gumby's going to be way more fun for me to remember. And then we have couch. And this house has a couch. There it is. Am I going to remember that? Maybe. But I could also imagine that my couch also invited a lot of other couches over and they had a party too. So anything that just makes it really quirky and fun for your brain, you're going to remember it. All right, so here are all of our strategies for review. So we have repetition, self-talk, chunking, visualization, mental retracing, face name pairing, mindful, memory, and memory palace. All right. Let's do a memory test. Okay. So I'm going to go through a new list of words. Try to remember as many of them as you can, and you can remember them in any order. All right. We have eggs, purple, sun, red, cabbage, moon, cloud, blue, bread. All right. I'm going to read it one more time again. Egg, purple, sun, red, cabbage, moon, cloud, blue, red. Okay. Don't write them down yet. I'm going to really test your memory this time. And now I'm going to talk about a couple other things. Okay, so there are two interesting phenomena that I want to tell you guys about. One is called the spotlight effect. And this is when you're trying to remember something and you're trying so hard and you're like, I'm so close. It's right there, the tip of my tongue, and I cannot find it. One of the reasons why you might not be able to find it is because you put all of your spotlights. And where is that spotlight going to? It's just shining a light on yourself and the fact that you can't remember something. And it's not doing a search anymore. It's just kind of zeroed in on you. Alternatively, you can try to kind of distract yourself and do something different. And what's amazing about your brain is if you have a task that's left unfinished, your brain doesn't like that. And it's going to keep trying to solve the problem in the background in your kind of more unconscious part of your brain. So you could be going on and doing something else, and your brain's going to keep trying to solve that problem for you. And this is why sometimes something just comes to you super quickly when you're watching a TV show or you're doing something else or having conversation. You're like, why couldn't I think of that in the moment I needed to? Because you had a spotlight shining on it. You couldn't get to it, but your brain helps you out. That's called the Zeigarnik effect. Okay, you can write down what you remember now. Did you remember more words? Yeah? You did? Okay. First set. Okay. Well, you were already using some strategies. So, okay. So some of you remembered more. Did you guys try any new strategy? Yeah. Chunking? Excellent. That's a good one. Yeah. Some descriptions. Okay. Great. You guys tried new things. That's great. I'm happy to hear that some of you learn new things. And sometimes it takes a while to like try different things out to see what your brain likes. Every brain's different. Some of us really gravitate towards one thing over another. I'm not a very visual person myself, so I actually do have a hard time with the visualization. I do better with chunking. We just kind of have to find what works better for us. And like I said, combining things is helpful. Okay. Okay, I got some really bad news for you guys though. Like really bad news. All those strategies that I told you, they're not very effective. I'm really sorry. I wasted all of that time. But I'll tell you why I did tell you that. But they're not very effective because they're really effort prone, or they're very effortful and they're error prone. So not necessarily the best strategy. And as we get older, we actually tend to use them less and less. And it may be because they're not as effective, and we need more effective strategies as we get older because of that memory decline. But this is a question that I get a lot. If I don't use my brain and try to remember information, will I lose it? Will I lose the ability to remember information? And my answer is no, there's really no evidence for this. There's no evidence that if you don't try to remember something on your own, that you're going to forget it. But there is some benefit to doing it anyway, and that's just more from a cognitive exercise. It's not that doing this is going to help your memory or improve it. You can do a lot of different things for cognitive exercise. You can do puzzles, you can learn a new language, you can read, whatever it is that you enjoy doing. This is just another tool in your toolbox, or another strategy that you can use to help your brain. I do have some good news though, and that is external strategies. External strategies are your tool for remembering things. And we have some amazing ones now with cell phones and other technologies that have been developed. There are some really strong external strategies that can help us. And research has shown that when we prevent the use of these external strategies, performance really suffers. And these external strategies are also practice guidelines now for cognitive rehabilitation for a lot of different neurodegenerative and neurological diseases. I'll talk a little bit about some strategies that can help with retrospective versus prospective memory. Retrospective memory is for something that happened in the past. Prospective is what's going to happen in the future. So let's start with retrospective. So here's some low-tech retrospective tools. There are some prospective here too. So, our list for shopping, our sticky notes, recipe cards, calendars, pillboxes, these are all excellent strategies. And here's also some more high-tech retrospective tools. And I love the low-tech versions. They're fantastic, but they still do have some issues with, for example, remembering to take your list with you when you go to the store. That doesn't always happen. So sometimes having it on your phone, which you're more likely to take with you to the store, is a better option. Or let's see, like a calendar. Great if you have a calendar, but it's not always going to send you an alarm to remind you that you actually have to do something at a given time. So there are still some problems with these more low-tech options. So some high-tech options for other types of problems would be something like an object locator. And there's various versions with this option here. This one here is a little bit more easier to use. You just attach these to different objects and you push a button when you can't find it. And then there's more high-tech options like tiles and GPS locators as well. Recording devices are really beneficial for remembering conversations that you've had or doctor appointments. Always, ask if it's okay to record a conversation. Most people will say yes. There are also pens that will both take what you have written down and pair it with audio information so you can take notes as you're having a conversation. And then you can pull it up on your computer or tablet later on, and it will have all that information synced together. This is another great tool. So if you lose this piece of paper, you actually have everything that you written down already. It's saved. There are also wearable cameras, and these can be really beneficial for people that have pretty significant memory loss. And it's just something that you wear on your body and you go about your day. And there's research that has shown that even after it's been over a week, that people or months, they still are remembering information that occurred during those days if they had the camera to look back on. There are also digital journals, which are really beneficial for remembering information that has happened in the past and can use it as a method to hang on to information. And my favorite, alarms. alarms that are paired on your cell phone, that are on your computer. There are low-tech versions and there are high-tech versions of alarms. And the more that we kind of combine these things together, the more beneficial they are. Probably the best memory support strategy that I could give to you are alarms. And then thinking about some everyday things that we tend to forget about for prospective memories, so things that are happening in the future, are medication dispensers. And there are some medication dispensers that I really like. It's low tech, but it's paired with an alarm. So you can set up your whole month at once and then have an alarm to remember. There's medication dispensers that are synced with your phone and automatically dispense the pills when you need to take them. Some other reminders for the future include the things like Alexa or Hey Google. These are very beneficial tools, but they can be a little finicky depending on the type of voice that you have or how slow or fast you talk. But they can be very beneficial for some people. There are also some more low-tech options as well that you can set a verbal alarm to go off at specific time. This is one that I really like, which is called Attendant, and it provides an alarm when you get within a certain radius around the device. So, for example, if you have a tendency to forget things when you leave the house, you get to the front door and you can have an alarm that says like, oh, don't forget your keys, don't forget your phone, don't forget whatever you needed to bring with you to an appointment. And here's another more lower tech solution. It's called a voice cue, and it's something that you can put on your body and you can have audio recordings of specific messages. So if you take medication several times during a day, this can be really helpful for that. All right, so let's go over some task modification strategies quickly. So in addition to the internal and the external strategies, there are things that you can do in your environment to help support you. So this would be placing things in a location that you go by all the time, that is kind of a home for that item that you know where to look for. And the other strategies are to be well organized, to plan, and to have a method for planning, to increase your effort or time on activities, reduce distractions, which is easier said than done, and to simplify tasks by breaking a larger task into more manageable pieces or putting things on like automatic bill pay. Now, when older adults use compensatory strategies, they perform better on everyday tasks. We see this in the literature. They have higher levels of independence, lower rates of functional decline or change. And even individuals with cognitive impairment, they can learn how to use strategies and new technologies. And they're accepting of new technologies, especially if it helps them be more independent. And it also reduces rates of caregiver burden. Importantly, it could help delay conversion from mild cognitive impairment to dementia. And that's what my research focuses on. So I develop technology for people with Alzheimer's disease and mild cognitive impairment to help them live more independent lives and to reduce caregiver burden. And one of the things that I've developed is called Interactive Care. It's an online web-based portal that allows caregivers to connect with the person that they provide care for who they don't live with. So really hoping to allow individuals who are having memory problems live longer on their own and in their own homes with as little assistance as possible. And it has a lot of different features that I've co-designed with individuals with cognitive impairment to make it user-friendly and easy to use. We have to-do lists, we have calendars with alarms, We have video chat features, notes, and brain health tools. I also have a wearable device that I developed that allows people to remember their intentions. So remember that doorway effect where you go into a door, you don't remember why you got here. I'm hoping that this tool can help with that. All you have to do is press on a button. As soon as you think of something that you want to remember, speak into it. And then that information is automatically transcribed and it shows up on the screen. And I think I'm going to stop there actually to allow some time for questions. So I'm going to zoom through here. And these are just some research findings that you'll all have access to online. But I'll go ahead and leave it on this page here, which is kind of a cheat sheet, if you will, for different strategies and areas of cognitive weakness and how to match strategies to help you in your everyday life. All right.
More about that device.
Oh, yeah. Sure.
So it's called Air.
Yeah. So this is. Yeah. Thank you. Yeah. So, well, you wanted to know more about interactive care. Is that right? You wanted me to talk more about it? Yeah. Do you have any specific questions or? Okay, that's a good question. Yeah, so this is within my research lab currently, so it's not available widely yet. I'm still in the process of developing and refining this tool right now. We are enrolling research participants into our study, so if you're interested, please let me know. But this tool is really designed for individuals who are having some memory problems, who are looking for solutions to help them with managing their day-to-day memory challenges. And it has a homepage, it has calendaring functions that are really easy to use and that I have been working really hard with some different participants and stakeholders on how to design this specifically for individuals who have no technology experience, but can really benefit from technology, because we know from research that having technology assistance is going to keep you more functional longer. And then it has different to-do lists that a person can set and schedule, different communication features for between the person with memory impairment and their family and care providers, a function that allows them to take notes and organize information in a separate caregiving section so that they can have notes that are separate and private. And then a section that allows people to set and track brain health behaviors. This one right here is, these are called vibration sensors. And this is something that I've been working with and collaborating with a researcher at UC Merced. And we're using these vibration sensors to track activities that are occurring within the home just by looking at vibration patterns. Everything has a unique vibration pattern. Our speech has a unique vibration pattern. And I'm really interested in being able to use patterns like people taking medication. Medication is something that's just really challenging and is one of the biggest reasons why people move from independence to assisted living. And my goal is to be able to use these vibration patterns to tell when somebody is taking their medication, to know if they took it and if they took it in the correct amount. I'm also interested in other healthy grooming and self-care behaviors as a marker for if somebody is maintaining their health or they're declining, or if there's an acute health change has occurred. The person hasn't gotten out of bed, or they're going to the bathroom a lot more than is typical for their behavior, things that their care team would want to know. So this is something that is also ongoing, but it's had some really good preliminary results.
I have a question for you, Dr. Weakley. You in the well, right here on the slide, you have functional. Can you tell us? I mean, cognitive and memory we sort of are familiar with, but what's this idea of functional intelligence or functional fitness, and how does that fit into your tools? And independence.
Yeah. Yeah. So we think about cognition in terms of brain function or what the brain can do. So cognition is kind of divided into several different activities. One being memory, others being language, attention, planning, those more higher cortical areas of thinking. And function, when I use the word function, I'm thinking of what the brain allows you to do that helps you remain independent. And some of the major functions that help us be independent are things like remembering to take our medications when we need to, paying our bills and being financially able to manage things on our own, driving. What else do I have? Finances. Or sorry, I clicked on cooking is another good one. So these are things that can decline and change when there's changes in the brain that are occurring. So these are important things to be able to maintain our independence. And I like to look at these in addition to cognition, because this is really kind of the barrier between being able to live on your own and not being able to live independently. And is really the barrier between having mild cognitive impairment and Alzheimer's disease are your ability to perform on these activities. So they're really critical.
Awesome talk. You mentioned how, something unique or surprising could help us remember things better. What about things that are just like nostalgia, familiar, or other emotional reactions? Or is there a way to leverage those?
Oh, absolutely. That's a really good question. Yeah, so if you're thinking about things that are interesting to you or how to incorporate more of your senses. We talked about like the five main sensory senses, but emotion is a really big, powerful tool that we have as well. And when I mentioned before, like what are the things that you have a lot of memories for? The big ones, right? Your wedding day, graduation, something like that. They also have a lot of emotion attached to them too. So emotion can be really something powerful. And if you can link something to an event or something that's emotionally, it has a lot of emotional content to it, you're more likely going to remember that information. So absolutely.
Yeah.
How do you remember to bring your cell phone? What's the strategy on that? Because I know somebody where I stuck a whole bunch of signs up that said cell phone. You're walking out to the garage, that door says cell phone. While you're sitting in your car, there's your garage door, it says cell phone, and you still leave without your cell phone.
Yeah.
Is there a better strategy on remembering your cell phone?
That's such a good point that you bring up. We can definitely become kind of habitual to some of the strategies that we put in place. So if we become really used to some strategies, then we're more likely to kind of ignore them after a while. So I can understand you put a sign up, it says cell phone. You see that sign 100 times and you're like, yeah, I already have my cell phone. You start to forget it. It's not as helpful every day. So other things that you can use are I think there are apps in your cell phone that if you leave without it, so if you have in your bag, a tile sort of thing, and it gets a certain distance from your cell phone will start to ring and beep. So that's one strategy. Another strategy would be to use something like the attendant, which was that little device that you would put on a door frame. And when you would go to the door frame and open the door, it would say, remember your cell phone. And it would be a verbal alert, which is a lot harder to ignore than something that you wrote and posted. Attendant. I will show you. It's in the slides that you'll have, and I'll write it down for you at the end.
Okay. Back to where the chair and the vibrations.
Sure. Yeah.
Okay, if I'm sitting in the chair, what is that electrical vibration going to do for me? I
So,
don't understand how it works.
yeah, great question. So the device, it, it detects when you have a vibration pattern that's unique. So it's going to know when you came and you sat down in the chair and when you got up and you walked away. It might even be able to know what you're doing in the chair. It might be able to know, are you watching TV? Are you talking on the phone? What kind of activities you're doing? And this is helpful for care teams to know or researchers to know so we can understand if there are changes in behavior that are significant. So, for example, if you usually get up and you come to this chair at 7 in the morning and you haven't gone out of bed and it's 10, then the vibrations will know that that behavior is different and can send a warning to your family member, for example. Or let's say you've been in the chair for 4 hours and you're not a person to sit around all day. You're an active person. Now we know something's going on here. Maybe he's sick. Maybe something happened. We need to send an alert right away. So that's really the benefit of these vibration sensors, is knowing what's happening in the home without anyone having to be there, without any video cameras having to be in place in order to keep people independent.
So I had a question, two kind of unrelated, but one. So one, neurodivergence, because I know I definitely am one of those individuals, and forgetting is extremely common.
Yeah.
And so is there evidence of like how does neurodivergence play in as you age? And then the other one that's kind of related, but as my generation continues to really indulge in cannabis, how does that engage with memory loss as well?
Okay. Both really good questions. So, I mean, it depends on the type of neurodivergence that we're talking about, right? But when I think about neurodivergence and memory problems, I think about attention deficit hyperactivity disorder. Was I on it? Okay. So with individuals who have ADHD at baseline, they're having difficulties with attention and staying focused, with planning, with executing things with all the good intentions that they have. And so at baseline, you're going to have to use a lot of strategies to kind of help yourself out. And these strategies all really, especially the external strategies, are going to be your mainstays. They're going to help you function really well. And I skipped over an important slide. And it's this one. So this is with older adults, but I think this really also applies with people who have ADHD as well. And it shows that when, the blue bar is mild cognitive impairment, and the yellow bar is our healthy older adults. And when people aren't using any type of compensatory strategies at all, individuals who have mild cognitive impairment perform poorly on everyday tasks, on this specific task that they were given. It's a prospective memory task or remembering to do something in the future. But when we look to see who was using strategies and who wasn't, the people with mild cognitive impairment who were using strategies, they performed the same as people who are cognitively normal. And I think that's really important, is when you're using strategies to help you compensate for the losses that you have, you can perform just as well as somebody who doesn't have ADHD. And then just like how memory kind of declines over time, as a person ages with ADHD, it's not that that's going to get worse over time. It's that your memory just naturally declines too. And so it's going to become more noticeable to you, or the strategies that you were using before might not be as beneficial. So you have to develop new strategies, or like use more strategies than you used to have to. But it doesn't put you at any increased risk for neurodegenerative disease or cognitive decline. It's just going to become more noticeable to you as it does to everybody else. Does that make sense? And then your question regarding cannabis impacts memory. Use strategies to help compensate for that.
I have 3 questions or requests from the audience at home. First, would you please put up the 9-word second list that we were supposed to remember? Everybody's on the edge of their seat. Do I have Alzheimer's disease or not? And this is going to be the moment where we'll decide.
Here it is.
There you go. Thank you very much. So everybody, there it is. You can grade yourselves. Keep your answers and your performance to yourself.
I can't emphasize enough. Not diagnostic, but if you have any concerns, reach out, get yourself tested.
There's 2 really great questions. The first is, do you have any strategies for those of us who have to dial our phone because we know it's in the house, but we can't find it, so we have to use our landline or somebody else to call our phone? You got any tips for those of us? Not me, but other people?
I'm not kidding. I had to do this earlier this week. Most phones, you can go online and go find my phone, and it will send, you'll type in your phone number and it will call your phone for you. And they can also do it with GPS location. So if you're not sure if you lost it in your house, or maybe you lost it like out walking, walking your dog, and maybe I lost it out there, at least like narrowing it down so it's in my house for sure and not, at the park or something. That could be beneficial. But use your strategies. It's okay to call yourself to find your phone. Use the different devices that you have at your disposal.
There's a therapy called applied behavioral analysis, and that's developed for kids that need some functional support, whether it's neurodivergence or some other attentional or behavioral issues. Do you know, has applied behavioral analysis been used for people with MCI or other cognitive aging related issues in this area?
Yeah, that is a really, really good point. And what's interesting is that a lot of the strategies that are now, and technologies that have been developed for individuals who are on the autism spectrum, are now being adopted and redefined and created for individuals with mild cognitive impairment and Alzheimer's disease. And there are a lot of technologies that have been developed for this population. They're early adopters. And I think we can learn a lot from the technologies and strategies that have been used in these individuals, and use them to help individuals with mild cognitive impairment and dementia with some tweaks. So definitely some areas that we can work together to create beneficial strategies and technologies.
If everybody's okay, I have one more question from the audience. So I do this all the time. I bet you have too. As a memory researcher, by the way, that's what you're doing the rest of your life, is looking for your memory. I lock the door, or I think I locked the door. I go back upstairs, I brush my teeth, and then all of a sudden, oh my gosh, did I lock the door or didn't I lock the door?
Yeah.
Tips, ideas?
I do have tips and ideas for that. Okay, so I'm just going to be the external strategy person. There are, and if it doesn't exist, look for it, Google it, because it probably does. There are smart doors. So you can install a smart door or a smart door lock onto your doorknob, and you can look remotely to see if it's locked, and you can lock it from afar too. And if you're not sure, you can lock it. It's really beneficial, and I like it especially for remote caregivers who are caring for somebody who has memory problems, and they can set the door, set timers so that it gets locked at specific times, and they can check on their loved one at night to make sure that they're safe at home. There are a lot of strategies that exist like that. Even lights that you can turn off from your phone, or turn on thermostat that you can set from your phone and check in to see what the temperature is in a home. A lot of really good remote technology strategies that exist now. So we're in this really interesting time where we have a lot of tools at our disposal, and sometimes it just takes Googling things or talking to an expert or somebody that is aware of these strategies that exist.
Well, that's really wonderful. Any other questions from the audience? I mean, yeah, we have one.
So, giving that example of locking the door and not remembering brings to mind that you have to be attentive to what you're doing. I think a lot of times when I'm introduced to someone, I'm not listening and paying attention to the name they're giving me. So, do you have any remarks about how attention is linked to farming the memory? I guess that would be memory formation and not recall.
Oh, yeah, attention's incredibly important. If you aren't attending to something, how can you expect your brain to want to hold on to that information? And I think a lot of times with remembering people's names, I think sometimes we just assume that we're going to forget it. We don't even attend to it in the first place. And then we get mad at ourselves that we didn't remember the name, but we've kind of taught ourselves there's no point in trying to. So a lot of those earlier strategies that I was talking about, a lot of it is really just learning how to attend to information and really being purposeful about how you want to encode that information. Because you have to have good attention to be able to encode it, and you have to encode it before you can retrieve that information later on. And so attention is really important, and is why people with ADHD have a hard time with memory, right? If you're not paying attention, it's hard to get that information in. And it doesn't have anything really to do with the memory structure necessarily. And so as a neuropsychologist, when I'm evaluating somebody's brain function, I always look at their attention. So I know, is it an attention problem or is it truly a memory problem? And when I say memory, I'm saying like the structure, that hippocampal structure that's really important for memory that's impacted in Alzheimer's disease. And if it's attention, then we can start to uncover potential reasons for why that person has poor attention. Is it related to a neurodevelopmental issue? Is it due to depression? Just because there's a lot of, external stimuli going on. Or is it related to a true memory deficit?
I think it would be interesting to see if practicing mindfulness or doing meditation would increase your attention.
It definitely can. Yeah, it definitely can.
Well, thank you very much, Dr. Weakley. I know I benefited greatly from your talk, and I really appreciate you taking the time coming out this evening and sharing all your work with us. So thank you.